Right, this talk is going to be on allergy prevention strategies. So allergies of all sorts, including asthma, hay fever and eczema, have increased dramatically over the last few decades, and we find ourselves in the middle of a so-called allergy epidemic. Now, a child without any family history of allergies has about a 15% risk of an allergic condition in the first few years. If one parent has an allergy, this risk increases to 50%. And if both parents are allergic, a child has an up to 80% chance of being allergic. Having a sibling with allergies also carries an increased risk of allergic conditions developing. Now, there are many confusing messages on allergy prevention, so I'll be talking about the ones with scientific backing that we currently recommend. What can we do during pregnancy to minimize the risk of allergies in the offspring? So the first thing to say is eat healthily. Eating a wide variety of foods seems to be beneficial. There's no need to cut out on any particular food groups for the sake of allergy prevention. For example, peanut or milk or egg, it doesn't help to reduce allergy in the offspring. So eat as before. Try and eat 2 or more portions of oily fish per week, and consider a probiotic in the last trimester if your child is at risk of allergies. In other words, if there's a strong family history of allergies. However, the best probiotic and the best dose are still under investigation. Also, don't smoke during pregnancy. The next section is on feeding the newborn baby. How can I best feed my baby to minimize the risk of allergies? Well, breast milk is best and has allergy prevention properties. The allergy reduction of breast milk is not complete, so even breastfed babies can get allergies. However, no formula milk is better than breast milk. In fact, we now know that there's no particular formula milk with any allergy prevention properties whatsoever. So none of the so-called HA milks help to prevent allergies, and certainly soya milk and goat's milk do not help prevent allergies. The breastfeeding mother does not have to eliminate any particular foods from her diet, except if her child is already showing signs of allergies, for example, eczema. In that case, please discuss the case with your healthcare provider. Now, breastfeeding for the first 4 to 6 months has the most benefit for allergy prevention, and continuing to breastfeed while introducing solids also seems to have some benefit. However, breastfeeding beyond 6 months has no further allergy prevention properties, but of course has many other benefits. In high-risk babies, consider giving them a daily probiotic and even a prebiotic, so healthy bacteria, healthy sugars, for the first 3 to 4 months of life. There is no absolute proof of this, but this does look promising. There is not enough evidence at this stage for vitamin D and fish oil for allergy prevention. Let's talk about the introduction of solids in terms of allergy prevention. So solids should be introduced when the child is ready, anytime from 4 months of age, and I shall be doing a whole different talk on solids introduction. There is no evidence that delaying solids beyond 4 to 6 months is beneficial. In fact, it may actually increase allergies. Start off with reasonably low allergy foods such as pear or butternut or rice cereal, and after that, you do not need to hold back on any particular food. So a month or 2 into solids, you can introduce even the highly allergenic foods such as eggs and nuts, as there's no evidence that delaying their introduction reduces allergies. The recently published LEAP study, which stands for Learning Early About Peanut, showed that the earlier introduction of peanut between 4 and 11 months of age actually decreased peanut allergy quite spectacularly in comparison to late introduction. However, if your child is already showing signs of allergy, such as eczema, or if there's a strong family history of food allergy, then ideally your child should first be assessed by an allergist between 4 and 6 months of age to check for evidence of food allergy and to guide the introduction of the so-called high allergy foods. So that's feeding the newborn baby. What about other strategies to prevent allergies? So there's now good evidence that keeping your baby's skin in excellent condition can reduce eczema, and eczema is often the first step in the whole allergy chain. This can be done by avoiding soap products and by applying a daily emollient, which is a good bland moisturizer such as cetamacrogol or emulsifying base. We don't generally advise on scented products, and many aqueous creams contain sodium lauryl sulfate, which is an ingredient that's very harsh on the baby's skin. Secondly, it seems that we need to be exposed to a healthy set of bugs for our immune systems to work very well. So it seems that an allergy prevention strategy is to have enough dirt and bugs in the environment. For example, farming environment is associated with a reduction in allergies, and big families with lots of siblings also seem to be protective. This is, of course, not practical for everyone. In summary, all in all, the best allergy prevention strategies are breastfeeding, following a varied diet in the mother and the infant, solids introduction between 4 and 6 months of age, no need to hold back on highly allergenic foods except if the baby already has signs of allergies, and lastly, keeping the baby's skin in excellent condition by moisturizing and avoiding soap products.